Welcome to our short interview series with housing and community advocates across the country. My name is Mike Loftin. I'm a non-resident fellow at the Urban Institute, as well as the CEO of Homewise, a New Mexico-based nonprofit organization that works on homeownership issues. And today, we have a very special guest, Lillian Montoya, who's the president and CEO of CHRISTUS St. Vincent's Hospital in Santa Fe, but serves all of northern New Mexico. And she's very thoughtful about housing issues and how it affects the people who live and work in a community. Has an economic development background, so has a very interesting perspectives on things. So I think you're going to enjoy this conversation. So welcome, Lillian.
Hey there, Mike. So good to see you on the small screen. We still haven't seen each other in person for a while.
Yeah, we will do this. It's light at the end of the tunnel. So you know, the question I wanted to lead off with, Lillian, is you know, lots of people in the social service sector and affordable housing sectors talk about housing as a social determinant of health. And I know it's something that you've thought about and you see in your everyday life. I mean, a major hospital, actually the biggest private employer in Santa Fe. You know, how do you see this affecting your work, and how do you understand the social determinants of health? It's not just housing, it's other social determinants. Mm-hmm. Just tell us what you're seeing and how you're thinking about it, and what do you think the role of healthcare is in addressing these issues?
So one of the, you know, we're in the second year of a pandemic, right? That first year was really different for us. We were, you know, our shortages were around personal protective equipment, having enough respirators. The volumes fell. So, you know, ensuring that people felt safe coming to the hospital and clinics to get care. The second year was really different in that our most precious resource of limitation was our humans. We have fewer people in the workforce. Many made decisions, family decisions about where to work. And because either they had family members who lost a job, or they had children they had to homeschool, or they had a parent they had to care for. And what we found is we've lost a lot of people to other communities because when the financials became tighter and tighter, they had to make different family decisions. Housing is one of those most expensive and yet really important social determinants that allow people to root into a community. So while we were losing staff this last year as healthcare, as hospitals have around the country in this last year and a half, we were also trying to recruit. And the recruitment challenge for us is it has its limitations. It's most certainly affordable housing, but it's also accessible, like being able to actually find it. The third is schools. And then with so much of schooling and education in flux, it made it very challenging for people that have young children. And then for those that are traveling here to work with us that have a spouse or a partner, their ability to secure a job and that's in the same community is challenging. So when 8 years ago, 8.5, when I joined the team, about 19% of our workforce commuted from outside of Santa Fe County. Right before the pandemic, it was already up to 23%. I'm running the numbers now. I'll guarantee you it's a much higher number now. It matters to me that our people can work and live in the same community because they'll stick around longer, they'll create families, and they get to be part of the community fabric. But we're feeling it on a workforce shortage, and we're certainly feeling it on a retention in the retention area.
Right. Well, and in Santa Fe, as most people know, I think is a very expensive housing market. Our median price of a home just went over $600,000, went up 30% in 1 year, home prices. It's the worst I've seen it ever after doing this work for 30 years. How does the hospital grapple with that? Because I mean, you're the biggest private employer in the city. You employ a lot of people. How do you deal with this affordable housing crisis?
Well, part of it is a relationship with Homewise and our relationship with Ancorum so that we can help people figure out what type of housing makes most sense for them. But in the most immediate need, honestly, we were having to bring in travelers and others to help fill out our workforce. And we had to work with them to try and find housing outside the county and commute in It was that desperate. Even we ended up leasing or renting some apartment units, CHRISTUS St. Vincent did, so that we would have something available when we recruited someone so that they can stay there until they found something more permanent. But we had to do some things just in the short term to accommodate. Even we created a web-based sharing system, if you will, on our internal intranet where people can share housing together, share childcare together, commute together, just trying to connect them to each other to fill in the gaps, because it's been pretty desperate in terms of trying to find housing in Santa Fe, especially in this last year.
Yeah, that's interesting. I didn't know you were doing those other things. That connection thing is very interesting.
Well,
it makes sense. It puts people in touch with helping each other solve problems.
Yes, and it's not perfect, right? I think it could be better, but find places to be here so they wouldn't have to do the commute.
Right. So I know, Homewise, you mentioned the hospital, and Quorum, which is the kind of half owner of the hospital and kind of a philanthropic arm, that where all of us are doing stuff together to help healthcare workers and hospital employees be able to afford housing in Santa Fe. Tell us more about what that work is and how everybody's working together.
Well, there's a match savings program that allows our people to start saving some money towards a house or other purposes. That gives them, it allows them to, you and I have talked about this before, but get into that headspace of having financial fitness, of how you manage your financial resources to plan, make decisions for your family. Even over time, the relationship with Homewise has included the down payment assistance. But I'll tell you, most of the associates I've talked to that have participated in the program have gotten the greatest amount of value from the learning around their finances, well before they've learned whether or not they can get a house or afford a house or move into a house or figure out where they want the house to be. Learning how to make some really important family decisions that prepare them for the responsibility of home ownership. That's probably the biggest takeaway they've had for their own learning.
Yeah, this is it's really great to hear that, because generally we talk a lot more in housing circles about down payment assistance and kind of the money part of things, but the knowledge part of things and people understanding, okay, what do I need to do to manage my money better? How do I improve my credit? Those are skills, and whether you buy a house or not, those are going to serve you your whole life, right? I mean, they're the soft skills, but they're so central.
Well, think about it. Those are things that we learned in high school when they used to have that civics class. You remember the one semester, 6-week civics? You'd learn how to balance a checkbook. You learn a little bit about the stock market. But there isn't a lot of that out there now. So when Homewise offers that service, it's filling a gap that people didn't necessarily know they had. Right.
Yeah. No, that's, and just I mean, more than any other employer I know in New Mexico, CHRISTUS St. Vincent is just this incredible partner as an employer that's really invested a lot of millions of dollars actually in down payment assistance and mortgage programs that help people get out of the cost of mortgage insurance, of doing this match savings. It's such a cool program where, you save $200 and then you get another 100 from your employer. And, so people end up, saving $1,500, and generally not a really long period of time. And it's like the difference between having $1,500 in the bank and having nothing doesn't sound like a lot of money, but emotionally, psychologically, feeling secure, it's a world of difference. And so it's really, it's really not an expensive program to do, but it makes such a huge difference in people's lives. I'm very proud of that program. And the fact that when we started that, you and I talked that, I don't know if you remember this, but we had a conversation at a reception, Chamber of Commerce reception. And you said, Mike, we need to do something. Whether people buy a home or not, we need to do something. And people are like, they're just strapped financially. And we brainstormed this and came up with this. And we thought the amount of money that we had available to do that would take us 2 years.
No, it
was like less than a year. It's like, hey, we got to go find some more money for this.
Exactly.
The response to it, man, we're dead on how important that program is. Okay.
When we've had town halls within our organization to talk about this program and others, we've had a number of people that they'll enter into the chat how it'll use the word you just used, they're proud of themselves and their ability to save,
Right.
because they had a resource, a knowledge base to lean into to get good at that, right? So they're very proud of it. But I'm proud of it because gives them another reason to stay with us. We're giving them a full package of things to learn and do and be a part of the community, and being able to save for your family is a part of that.
Yeah. Well, I think the stuff that you've done too, these kinds of programs, a lot of other stuff that I know you've led at the hospital. It's like, for several years now, St. Vincent's is at the top of the list of one of the best employers to work at.
Well, and I'm very proud of that.
Yeah.
We've earned that best place to work designation for 4 years in a row, 2 of them during the pandemic. And I have to say, when we achieved that, when we earned that very first year, I knew that the go forward was going to be so different, because for us, fundamentally, if we focus on taking care of our employees, our associates, they'll take better care of patients, and they'll be nicer to their colleagues, and they'll go home and they'll be refreshed, and they'll be enthusiastic about their work, and their kids get to see that. So when I talk about it, yeah, we've transformed within our organization, but I feel like we're transforming the way of work in Santa Fe. Yeah. Because what does it mean to do meaningful work and joyful work, and having your children bear witness to what that looks like means they'll start to think, well, that's what I want too. I don't know. Some people want the soft stuff, but I think that stuff matters, because if you feel respected and supported, and you work with people that you respect and who make you laugh, then you're going to want to come back the next day and get more of that.
Yeah. And like you say, it's contagious. It spreads out. It's goodwill is contagious, and it's great. It's good for the hospital, but it's great for the broader community. Well, let me ask you one last question. So, the hospital itself has done a lot to help its employees access affordable housing. What advice would you give to local officials and state officials on how could they be helping with this problem? It's not, it's very centered in Santa Fe, our affordable housing crisis. But now you're starting to see it affect the whole state. So what should the state and the city, what advice would you give them? How should they be stepping up?
I think there's a lot that can be done to help our communities and individuals within communities have that financial fitness, the services that you're providing in Homewise, whether it's the banking industry providing that support and resource. I think people need to know that home ownership is possible for them, but if we don't show them the path, how will they really know? I think having available access to housing options is really critical in all the communities. I know it's a big part of our conversation here in Santa Fe, but my kids are out of state, and they're at a time now where they should be buying a house, and they feel like they don't understand why they should if they can't even access something they can afford, right? So communities need to be able to, for that first time home buyer, be much more aggressive about helping them acquire that home.
Right.
And it should be built into the fabric of what a community delivers. It's housing, it's healthcare, it's access to food and grocery, transportation. It's the whole that whole ecosystem of what it means to have community.
Right. Yeah, and I think to your point is like, how is a young person starting out in their career going to afford a home at $600,000, right? They're just not.
Not.
So unless we add to the supply of affordable homes, we're just never going to get ahead of that curve.
I agree with you. And I again, my kids are close to 30, and they haven't bought their first house. I bought my first house when I was 22 because I knew that I should and could. Right. They're not in a rush. And I'll tell you, there's probably a lot of people that aren't in a rush because they don't think they can afford it, and they're not being getting the advice and guidance in securing it, but communities aren't doing enough to prepare them for it.
Right. No, I think that's right. So we got some work ahead of us, but we're committed.
Yes.
So anyway, Lillian, I really appreciate you taking time to have this conversation, and let's be in touch and let's do this again sometime.
Let's do this again. Have a great week.
Okay. Thanks a lot.
Mm-hmm.